I think what I'm most proud of is the patient outcomes that I see in patients who I've taken care of all throughout my training and even now as a vascular neurosurgeon, seeing them at their most difficult time and then being able to take them through that treatment process and seeing them on the other end in clinic being healthy and back to their normal life is very rewarding. Vascular neurosurgery is anything that involves the blood vessels in the brain and spine. That includes diseases of the blood vessel, blockages of the blood vessel, or when blood vessels rupture. So as a vascular neurosurgeon here at MedStar Health, I deal with those pathologies and patients dealing with disorders of the blood vessels, both in the brain and spine. So within vascular neurosurgery, some of the most common conditions that I treat are aneurysms of the brain, which are balloon dilations that are abnormal, blockages of blood vessels in the brain or spine, which can cause stroke, vascular malformations, so abnormal creation of blood vessels in the brain or spine, or abnormal collection of veins called cavernomas, as well as blockages in vessels like the carotid artery, which also supply the brain. These conditions are very serious, but there are treatment options for patients, and these can come in the form of minimally invasive treatments, such as endovascular treatment, where we go in through the blood vessel to treat these conditions, or it can entail open surgery, where we do a microsurgical treatment. We have to open up the brain or the spine and do an open surgery to treat these blood vessels directly head on. When we do these treatments endovascularly, it only takes a groin puncture or a wrist puncture, where we go in through these arteries, navigate these catheters using X-ray guidance to get to the treatment pathology, which is up in the brain. This is great for patients because it's faster recovery. They don't have to deal with the recovery that comes after an open brain surgery. It allows them to go home faster, and it doesn't require any sort of large incision and can be done through a small puncture site. Advancing the field and research is a big part of the reason why I became a vascular neurosurgeon. Here at MedStar Health, we have clinical trials going. We have the latest technology that we can offer our patients, and all these are being studied to improve patient outcomes. These complex conditions within vascular neurosurgery are important to be treated in a multidisciplinary fashion. And so here at MedStar Health, we work very closely with our stroke neurologists, our critical care colleagues, to provide the best care for these patients so that they have the best outcomes. I think it's a privilege to be able to help people in their most critical time of need, whether they had an aneurysm rupture or they're dealing with a stroke, and be able to treat that and take them through the recovery process and see them come out a normal person at the end.